uh, talk a little bit um, about what we do, and then I'm going to hand it over to Jill to also lead us through some conversation and discussion, which I'm really looking forward to. So I want to start. This is just an agenda about what we want to do with you all today, and hopefully have lots of time for discussions and questions that you might have for us. So just briefly, who we are. So as I mentioned, we're in the reproductive health program, which sits in the adolescent screenwise and reproductive health section in the public health division. And our vision is that all people in Oregon have reproductive autonomy, and that includes having access to high quality reproductive and sexual health services, knowledge, and resources. And the ways in which we do that primarily are through partnerships with clinics, community-based organizations, and with policymakers. And we commit to working towards racial equity by addressing racism, acknowledging implicit bias, and shifting how we do what we do. So what do we do? I'm going to talk a little bit about our clinical services program and partnerships with LPHAs, and then Jill will move us into the rest of the conversation. So we work with a statewide network of over 150 clinics across the state, and that network includes local public health authorities, FQHCs, university health centers, school-based health centers. And as part of our partnership with them, clinics must adhere to a robust set of programmatic requirements to receive reimbursement for services. So we see ourselves as more than just a funder, but really trying to assure and lift up high quality, culturally and linguistically responsive services. So our certification requirements are pretty robust, and they really center around ensuring high quality reproductive health services. And our program receives three sources of funding. We operate a Medicaid waiver program called C-Care, Title X, which is a federal grant program, and then we also use state general funds. And we use that funding to administer clinic certification with this network of clinics. And so clinics have the option of certifying with us as RH care providers, C-care providers, and/or abortion care providers. And by becoming certified with us, our clinics have access to coverage that we offer to clients to reimburse for these reproductive health services. And this is called the Reproductive Health Access Fund. In terms of the covered services that our clinics offer, for clinics that are certified as RH care clinics, they offer comprehensive family planning and associated preventative health services related to achieving or preventing pregnancy. So this includes annual well visits, STI screening, preconception counseling, and contraceptive counseling and supplies. Clinics that are certified with us as C-Care clinics, it's a little bit narrower in scope in terms of the care. It's primarily around contraceptive care and counseling services to prevent pregnancy. And then our abortion care clinics, we provide coverage for abortion services and post-abortion contraceptive services for a small population. Our funding that we use to support these services is specific to immigrant communities that either or have no documentation, haven't met the lawful permanent resident 5-year bar. Sorry, I lost my cursor. So clients who go to these clinics for services are able to enroll on site in our Reproductive Health Access Fund and receive same-day services and supplies. And it's pretty expansive eligibility. Essentially, anyone who is at or below 250% of the federal poverty level can get pregnant themselves or get someone else pregnant and is not enrolled in full benefit OHP. And we definitely recognize that over the last few years, the health sort of care system in Oregon is shifting, and more folks have access to OHP, which is great. It means that people have full benefit coverage, especially with the expansion of Healthier Oregon, that really opened up a wide um, access to full benefit coverage for populations that we had sort of traditionally been serving under the Reproductive Health Access Fund. So it's important to note that all of the clinics that we work with serve OHP clients. And one of the things that I do want to mention, which I wasn't in the services slide, is that one of the unique aspects of the clinics that certify with us is that they are all required to provide contraception on site. We really think that's a huge opportunity to address barriers people have in getting to a pharmacy or have a delay in getting the contraception that they want. So a little bit more about our clinic network. I've included a link here to the webpage that we have around finding a clinic. So folks can search for clinics by county, and you'll see on the map on the right that we have pretty broad access. They're generally RH care clinics, which are our kind of most comprehensive certified clinic type in most counties, although we definitely acknowledge that there are gaps in geographic access, and there are deserts in which there may be no certified RH care clinic and very limited providers who are offering what we consider to be comprehensive reproductive health services. So I'm going to move on from the clinical services side of what we do and talk just briefly about the partnerships that we have with LPHAs, with local public health authorities, through a program element, which many of you are probably familiar with. If not, program elements are the programmatic deliverables that local public health authorities have with the public health division. And it's the way funding for certain programmatic deliverables are distributed to LPHAs. And our specific program element is PE 46. And the purpose is to have LPHAs assure access to reproductive health services through meaningful community engagement and partnerships in the development of responsive policies and programmatic actions. And the idea is that the funding can be used by LPHAs to really work with community partners to both identify gaps and barriers to accessing reproductive health, to identify programmatic or policy solutions. And the LPHAs do this in a number of ways. Many have created local coalitions with a diverse network of community-based organizations, right? Sort of non-traditional partners in the reproductive health space. Really this idea of expanding focus in order to assure access to reproductive health. We have had LPHAs do assessments in their local correctional facilities to better understand the needs of people housed there. We have folks that are working in places like DV organizations, food banks to increase access to reproductive health services. So this is not a huge amount of money that we have available for LPHAs, and based on the size of the LPHA and the amount of money we're able to distribute, the sort of the scope and breadth of what they do differs. But it's something that we really, we recognize that LPHAs play a unique role in better understanding the needs of their community. So with that, I'm gonna pass it along to Jill to continue the conversation. You ready, Jill?
I am ready. Thank you, Emily. And thanks, everybody. Hi again. I'll introduce myself one more time. I'm Jill Verbeck. I'm the Partnerships and Communications Coordinator, along with Emily. We are part of a larger group of folks who work in reproductive health. And as Emily was sharing a little bit about the clinical and LPHA work that we do, who are also very much part of our communities, right? That's where our communities go. That's who our community works there. Our community provides those services. And that's what our program has done more traditionally. I would say in the last 5 years or so, our whole program has done a bit of a shift, in part with the hand under the hand of Dolly as well. She had a very real touch in some of this work, some of this shift, and you'll see reflected here. But I'm going to share a little bit more about the work that we have been doing in the last 4 or 5 years, specifically working with CBOs and specifically kind of working on focusing on community in a broader sense. So outside of the clinical network, outside of LPHAs and that sort of thing. So to get us started, I'll share some of our CBO work. Next slide, please. Back in 2019, we set out an RFP statewide to do what we're calling community outreach and education projects. And the goals of this projects include were really to promote health equity. And we saw a number of ways that we could really make an impact in that sort of work. We wanted first to prioritize outreach to communities most impacted by systemic inequity. So REA eligible folks were kind of the priority. That's where the funding came from, the Reproductive Health Equity Act, or REA as it's more often maybe commonly known. Folks who may not have been eligible for OHP because of their immigration status. Prioritizing BIPOC communities, immigrants, rural communities, thank you. Youth and other marginalized groups. We sent out a request for proposal. We reached out to community-based organizations and said, if it feels like you would like to do education and outreach about sexual and reproductive health to these communities, please come work with us. We really wanted to work on addressing and transforming systemic inequities. One of the things that we really wanted to do as a program is to hold ourselves accountable as a state agency, as a partner in community, to be responsive in all the different ways that we can be. We wanted to be collaborative. We wanted to work along with community partners, community leaders, and with an end goal of increasing cultural responsiveness in outreach and education and in clinical services. Some of the feedback we get via our CBOs, via our community partners, just comes back to us, and we can share it back with our clinic network when possible. Next slide. All right. I'm going to ask, I recognize some folks out there. Can you, if you're with us and you work with one of these outreach project partners, can you give a little heart emoji? So if you work with one of these organizations, can I see you out there? If you work with Virginia Garcia, Healthy Birth Initiatives, Asian Health and Service Center, with Interface, there's Christine Kant, thank you, COOS, Health and Wellness, Latino Network, Planned Parenthood, UValcree, Outside In, Unite Oregon of the Rogue Valley, Papalaximisha, or Base in Southern Oregon. Where are you? Can I see you? Fantastic. And how about if you work with or are familiar with one of these organizations? Can I get a little, what's another emoji we can do? How about a clap? A dozen folks on that question. Yay. There's one of them. So glad to have you there. So you'll see kind of the joy of my work is working with the folks in these organizations and really hearing from them about what's happening in community. I'm so glad we're all here together. Thank you, folks. So Virginia Garcia is an LPHA, an FQHC out here in Washington, Yamhill counties. We have Healthy Birth Initiatives, which is a new partner at the Multnomah County Health Department. Look at us. They serve Black pregnant parenting families in the Multnomah County area. Asian Health and Service Center for serving Asian language immigrants throughout the Portland metro area. Interface in Polk and Marion, serving youth and immigrant communities, Spanish-speaking communities. COOS Health and Wellness, a more rural organization, LPHA, out in Coos County, trying to grapple with all the challenges of being a rural-based organization. Latino Network. I know I have some friends here from Latino Network. Hi, folks. Planned Parenthood of Columbia, Wyoming. There we're doing a lot of outreach education work in Polk, Marion, and Washington. UValcree out in Eastern Oregon. Anyone here from UValcree? Outside In as an LPH, as a, there you go, Doulas Latinas. Good to meet you. And we have Unite Oregon of the Rogue Valley. We have Outside In, a clinical provider here in the Portland metro area. Papa Laximisha, who's one of our newest members. They work in Warm Springs Reservation, doing really amazing, wonderful things that I'm so proud to get to kind of witness and be a support to. And BASE is a Black African American serving organization, smaller organization in Southern Oregon. So you'll see we've really made a priority to recruit and work with and support the work of folks across the state, working with various kind of communities and organizations in various ways. We're proud to be working with them for a number of years now and to continue working them for a number of years to come. Questions about this one so far? So this is one way we're working with community-based organizations. This has been a big shift. Next slide, Emily. Some of the things that we do together is, as Emily mentioned, we are clinical, we support a clinical network. So some of our outreach projects they're all engaged in making referrals to reproductive health services and abortion care. So folks in their communities who are looking for that sort of information or that sort of access, support with them enrolling in coverage, the Reproductive Health Access Fund that Emily mentioned, so helping them fill out kind of that application. Many of our friends are working on curriculum development and facilitation, sometimes with parents or caregivers, sometimes with youth, sometimes in the schools, sometimes in various spaces, sometimes one-on-one. A lot of our folks are doing outreach at community events in schools for some of these organizations and some of these partners. Talking about sexual and reproductive health in their communities has been an entirely new endeavor that they've taken on throughout these outreach projects, and really sort of normalizing and making the community comfortable with having these conversations, providing information not only about services, but what is healthy sexual and reproductive health? Is it healthy relationships? Is it consent? Is it having a provider who can respond to your needs? All of those sorts of different things. So outreach is a big one. A lot of our organizations are engaged in participant recruitment in those conversations, recruiting youth to lead other youth groups to talk about sexual and reproductive health. That's been a big focus of these outreach projects as well. And one of my favorite things has been the community building that we've done together. So the group of 11, 12, we all meet monthly, every other month. And we have what we're calling collaborative webinars, where folks get to share the work that they're doing, share their expertise, lessons learned. Somebody needs help in Marion County, they have somebody they can reach out to. Somebody needs help working with youth, we can talk to our friends who are already engaged in that work. So there's been a lot of information sharing and community building, and it's just lovely. And if you're here, hi, thank you for doing that with us. So those are some of our project activities that we've been doing. Next slide. One thing that we've also been doing, kind of a little bit separate, but maybe also the same, but in a kind of a different format, is the Spanish language group. Can I get a little emoji if you've been participated in the Spanish group that the RH program facilitates with myself and Azucena and Laura Hunsinger from Screenwise and Katrina from Reproductive Health? If you've been part of our quarterly Spanish language group where we talk about sexual and reproductive health in Spanish, what did I get? I see you. Te veo, love it. One, all right. So every quarter, this is kind of a new thing that we saw. We heard from some of our community partners that there's staff and others that just feel more comfortable speaking in Spanish. We might be fully bilingual, that sort of thing. But sometimes in the language that we grew up speaking, these conversations just feel more comfortable, and it feels more community safe, community oriented. So every quarter, for the past couple of years now, the RH program has been hosting a Spanish speaking webinar. There's a lot of Spanglish. I'm there, so if you're not that confident in your Spanish, but you want to come hang out, trust me, I set the bar pretty low in terms of my Spanish fluency. So, and we just build skill building and skill sharing about sexual and reproductive health. So like Contraception. We've had conversations about contraception. What are some of the myths? What are some of the ways we can access that? Last month, we talked about breast and cervical cancer screenings and HPV vaccines and that sort of thing. And it's just a group of folks who speak Spanish and who serve Spanish speaking populations. You don't have to know anything about sexual and reproductive health. Your organization doesn't have to be directly involved in sexual and reproductive health work. Or like some of our friends from Familias en Acción and other places, that really is your focus. And you want to come do some resource sharing and some community building. So Michael Couch, you are welcome to come to the Spanish group. You are invited. Le invitamos con mucho gusto. So I'm going to send a link. And if you're interested in being part of that group, it's pretty informal. Show up. If you have a topic you want to share, information you want to share, we'd love to have you. It's pretty fun. I'm pretty proud of us for that one. I'm going to send you, I don't know if we have flyers, Michael, but I'm going to get your email and I'm going to include you on the list, the invite list, if that works.
Jill, this is Dolly. I think
Yeah,
that if we can share out after this meeting that information with the whole group, we can send a follow-up email because I have a feeling there's a lot of people that would be interested in this group.
I love that. I would love that. It's pretty rad. All right. Chido, no? No. Oh. Next slide, please. All right. What we do, another thing that we do is our program is responsible for providing information and education. Yes, as Emily mentioned, kind of to our clinical providers. We have nurse consultants who provide technical support and all of those sorts of things to clinical providers, people working and providing those services. But we also see ourselves having a role and a responsibility to provide information and education to communities. So to folks working in community-based organizations, to just community members themselves. So we're just going to share a little bit about how we hope that you can count on us as a partner and a resource in doing that. And we want to do that by first off, acknowledging that kind of the climate of sexual and reproductive health um, in our nation, perhaps, and even in our state, maybe for some, is confusing. And there's a lot of miscommunication and a lot of like, maybe even for folks are afraid. Um, but so we know that the work that you do day to day is invaluable and necessary to kind of dispelling misinformation, to supporting folks to know their rights, to shift the culture, to change the conversation, to decrease stigma about sexual and reproductive health, normalizing having open conversations about these topics, and really supporting communities to know their rights. This is our strength. Our strength in our numbers is that we can support community, kind of counter some of the misinformation or some of the fear. And that's one thing that we would like that we try to do. And if there are ways we can do better, we would love to know. So you're already our partner, whether or not you know that. One thing, next slide. Yeah. The next slide. Yeah. So we have a printed and educational promotional materials. At the end or at the follow-up, we'll include kind of a link to that. This is an example of one of our resources that is more specifically related to pregnancy options. So for instance, if folks are coming into one of our clinics and they find out that they're pregnant, they can talk with a provider in all those moments, in that moment or at any moment, and talk about different options they have from learning that they're pregnant and get that support. You'll see that our program makes a very much effort. Yes, in Spanish too. This one isn't quite translated or fully ready in Spanish, but yes, we make every effort to get things translated as quickly as we can. I will provide a caveat that our materials right now are sort of like in a big transition. But you'll see we make every effort to make things appealing and accessible and that sort of thing. And we would love if you're interested in providing feedback about our educational and promotional materials, also you can talk to us about that too, because we always welcome and need support with that. So here's an example of printed educational promotional materials for community. Next page. Another thing that we try and do is provide access accurate information about sexual and reproductive health and abortion access in Oregon. So Emily and some of our other colleagues worked very, very hard to create an abortion access in Oregon website. This is the first time we've ever had one in Oregon. I'm extremely proud of my coworkers for having made this. I've heard from community members, a little emoji if you've accessed this website yourself. And I want you to know, and I want you, excellent. I want you to know, and we all want you to know, you'll see something here now that you can access. You can let community know if they have questions about abortion access in Oregon, that they can go to this website if they'd like to, and they can be sure that they're accessing accurate, updated information about abortion access in Oregon. So this is trusted. This is a trusted source of information with all the confusion or all that sorts of thing. So that's one thing we know right now in Oregon, is that we have this resource. Next slide. One thing that we'd love for you to communicate with community when you're out there, how long has it been, Emily? 2 years, 3 years? I can't keep track of time. It's been a little while now since the Supreme Court decision, the Dobbs decision, as some of us know it, that overturned Roe versus Wade at the federal level. It did not impact abortion access in Oregon. Access to abortion is the same as it always has been, in terms of it is safe and legal in our state, one, to both receive an abortion, and two, to provide an abortion for providers. So if folks are confused whether or not, I'm going to ask Emily to help me with that question from Misha there. Emily, can you
Hi,
help? Yeah.
Misha. Yeah, and that's a good question. And we know there's a lot of fear around this because states, conservative states that are hostile to abortion are sort of establishing all sorts of laws trying to criminalize people and providers and supporters um, for people seeking abortion. People in Oregon, anyone from Oregon or outside of Oregon can access abortion here safely and legally. There's nothing in Oregon that would get anyone into trouble, right? We are sort of what we like to consider a safe haven. At this point, it's really hard to give very clear advice and guidance to people who are coming from other states because we don't have control of what other states do. We make every effort to ensure that people's information, if they come here for abortion services, is kept confidential. We have protections restricting providers from releasing information, even if there's a court order. So, there is, in particularly in Idaho, a bill that is what's called an anti-trafficking bill that is meant to uh, criminalize people who help support minors to go to other states to access abortion. That law is currently on hold. It's not being enforced. But there are on our website, under the legal and privacy rights page, information for people both who live in Oregon or who might be coming to Oregon for abortion services. There are resources to help them understand what their legal rights are and what concerns they might have. It's a repro rights legal hotline that the Department of Justice and Attorney General's office is running, and people can speak to lawyers and even lawyers for people who are coming from out of state. So that was a very long, maybe not very clear answer, but I think that just highlights how murky things are. Does the
And
state
just to be
of
clear, that was a
Oregon?
question. That was a response to the question. If you weren't able to see it, is it true that people can get in trouble for crossing into Oregon for an abortion? And Emily shared with us that Oregon law protects folks, but some of the laws from the other states are a little bit murky and hard to sort of like for us. But there is a resource on our webpage where folks can get answers to that too.
Yeah.
Emily, more legally focused question. Okay.
Yes, definitely. And
Yeah.
and I see that Heather is really helpfully dropping links into the chat. So yeah, that really probably should have been my first response, is that page has information that people can access for more information.
Can you go back to that page? I think we have a screenshot of what that website looks like if folks haven't
Yeah.
opened it.
So it's under the legal rights and privacy page.
Thank you. And then there was another question there, Emily. I don't know if you saw it, and I'm hoping you can help me with it. Does the state of Oregon assist out-of-state requests for abortion pill access. What have been your experiences with this?
I may need a little bit more information, CJ, for you to provide in the chat. Um, there, we do have providers in the state of Oregon who offer telemedicine abortions. So what's telemedicine medication abortions are sometimes called telemabs. Um, Generally, though, because providers are licensed in this state to provide care in this state, they will often require someone to be in the state of Oregon to receive the pills. There are other organizations, and we have a link to those under the Where to Get an Abortion for national organizations that provide medication abortion access by mail for folks living all over the country. So I would definitely refer to that page for more information. So hopefully that answered your question. If not, if I can do more to clarify, drop your question in the chat.
Okay. One thing we'd love for you to be able to communicate with community, as Emily was saying, is that there are many ways to get sexual and reproductive health services paid for in Oregon. As she mentioned, folks having with OHP can access reproductive health services, get all their services and supplies paid for. And also in Oregon, these Medicaid OHP dollars can be used to pay for abortion services as well, which maybe isn't true in every state. Private insurances are required to cover reproductive health services, including abortion in Oregon. It might get a little bit, Emily, let me know if I'm misspeaking just a little, if I'm not being completely accurate. And then, of course, as Emily mentioned, we have the Reproductive Health Access Fund through our program. So at any one of our clinics, folks can fill out this application and get all of their services paid for, get their supplies on the same day, and all of that sort of thing for the most paid for. So we would love for you to be able to communicate with community that we know that folks can have their sexual and reproductive health services and supplies paid for in Oregon. And so if money is a barrier, that sort of thing, you can encourage folks to know, hey, actually, you know what? Why don't you? There's this. Dolly, did you have a question?
I do have a question. So, Jill, let's say that I am a young adult and I am still on my parents' health insurance, and like I don't need them to know my business. What are my options?
Emily, unmute yourself, dear. You're muted, Emily. Emily?
Sorry, I think I was not muted before and I just muted myself. So thank you. So that's a great question. And that is one of the key aspects of our coverage program, the Reproductive Health Access Fund, is that individuals, even if they have private insurance, if they're eligible for our funding, so again, the criteria is that they are at or below 250% of the federal poverty level, not on OHP, and are of reproductive capacity, then they can enroll in our program. And if they let the clinic know that even though they have private insurance, they're maybe worried about information about their visit, like an EOB, an explanation of benefits, going home, they can request confidentiality, and so that the clinic won't bill private insurance and will instead bill our program and can be assured of complete confidentiality.
Emily's got you, Dolly.
Okay, so can I ask another scenario? Okay,
Yeah.
so let's say I, Dolly, got pregnant. Whoa, that'll be alarming if it happens. Um, let's say I got pregnant and I do want to keep that baby, but I don't know what I should do. Is that kind of information shared?
Yeah, so that's also one of the key kind of core services that are offered by clinics that are certified with us. So all clinics who are RH Care or C Care or abortion care certified are required to offer comprehensive all options pregnancy counseling in non-biased, evidence-based ways so that folks can have information about parenting, adoption, abortion, and they all are required to provide referrals to the to the sort of service provider or type of service that a client is interested in, and will do their best to connect to you in your hypothetical pregnancy situation to prenatal care.
So that is a great explanation, Emily. I just want to be clear. So in the state of Oregon, clinics are required to provide all options as part of the laws so that me coming in would get all of the information so that I could choose what's best for me and my family.
Yes. And that is something that the Trump administration actually reversed that requirement in federal funding that we receive and prohibited information about abortion. And so, as a state, we withdrew for a time from Title X and maintained our requirement that everyone get access to the full range of options in terms of pregnancy. During the Biden administration, they reversed the rule and we re-entered the Title X program to start receiving funding. But that has been definitely a core foundation of our program to ensure that information is provided in a client-centered way that really is meant to meet the needs and wants of every client, whatever that option might be. And I should say, sorry, I just we actually, and Jill had a picture in a previous slide about the Reproductive Health Equity Act, which was a landmark bill that was passed in Oregon in 2017 that was kind of led the way in the nation around assuring all sorts of access to reproductive health care information and services. And so if you, in your scenario, if you found yourself pregnant and had decided that you did not want to maintain the pregnancy and you wanted information about abortion, this state law, the Reproductive Health Equity Act, prohibits any interference in providing that information. So providers have the right to provide any and all information about abortion and to provide abortion without any interference from a public body. Jill, I'm wondering, given where we are with time, whether we want to kind of open it up. I know you probably want to get this information out first.
Oh, no,
And
not
then,
really. So I think we already mentioned that. So this will
okay,
be, so we're gonna find ways if you want to get contact with us about the Spanish group, if you want to find out how to order materials through us, that will be part of the way that we can connect. You're gonna have my email. I would love to connect with you if you have ideas or that sort of thing. Emily has an email too, of course. You see in Emily's brilliance and expertise. And so if there's any questions kind of from both of our worlds, let us know. So, and let's open it to questions. Oh, looks we already have one. And it
and
looks like
actually,
Mercy.
I'm going to stop sharing my screen so we can better see each other because I like to see your faces.
So Mercy's question is, hi, everyone. I am wondering if there is outreach and education around the prevention of unwanted pregnancy. Absolutely. I would say in part that comes through our funding. So I think if folks were going into our clinic and that sort of thing, and we're saying, I want to prevent, I don't want to get pregnant for the next 5 years or for the next 6 months or that sort of thing, there would be a lot of education and conversation happening within those clinics. I would also say that there's a big part of that's what our outreach projects are doing in a lot of ways, in their own ways, and working with communities. That there is, you know, prevention of unwanted pregnancies, but I think what our program is really doing and really shifting in a lot of ways is that it's not just about IUDs um, and implants and birth control pills. It's about finding ways for folks to have, you know. Um, to know about healthy relationships and consent and doing a more holistic approach to building families if and how folks want to build families. So kind of shifting unwanted pregnancies more to like, I think as Emily shared with us, that people have reproductive autonomy and they get to choose and how um, they frame their, sort of family planning for their life, that sort of thing. What would you say, Emily? Would you have anything to add to that?
Yeah, I think that's great. And I would also say that as Jill really highlighted, we've really tried to shift the way we do work in the past 5 years. Our program historically was really focused on the clinical services side of our program, and we recognize that that is an important access point, right? And that's where a lot of information and education and counseling happens. But we also know that it happens in different spaces for people. And that's really, I think, one of the purposes of the community outreach projects and other work like the Spanish collaborative is meant to really highlight is that education and outreach happens in all sorts of different spaces. And we want to support communities in getting that information in whatever way works best for them. And so I think we are always super interested in hearing from you all in terms of places we're missing where we can support you all. So yeah, that's what I would add.
I'm just
Oh,
going
I
to
see,
answer.
Marcy, you have your hand up.
Yeah, go ahead, Mercy. I can't hear you.
Oh no, we can't hear you, Mercy. Your audio isn't working. But I have a feeling part of what she's wanting to know is what I asked in the chat. Like, well, then how can CBOs that are interested in doing reproductive health outreach and education to prevent pregnancy, what can they do? Mercy, try it again.
Yeah, I think you're right, Dolly. That's what she's trying to discuss.
So right now we're currently working, as I mentioned, with 11, 12 organizations. There's some questions about funding and some uncertainties about funding, especially with this being an election year and that sort of thing. But I also think I also think we're eager to find ways to be uniquely to work more uniquely with folks too. So whether or not folks are going to be formally engaged in the outreach projects or not, I think that our program has some room and some interest to find ways how we can partner with you. So if it looks a little bit differently, we would love to just sort of like meet and keep in contact and find ways that like we'd love to hear from you. Maybe there are ways that you would like to do reproductive health outreach and education that look different than the ways that we've sort of framed our projects. And so we would love to hear without any sort of like any authority to provide any promises or any sort of like anything like that. I know that we're really eager to like build relationships. So
Hello,
please
can
reach
you hear
out.
me now?
Yeah.
Can you hear me?
Yes. Can hear
Okay, thank
you.
you so much thank you for this topic. It's very healthy for the community, and I appreciate everything you have said. It's just the fact that I have had conversation with, I really do have connection with a lot of little girls that really look up to me. And it's like, I didn't want to get this pregnancy, but I also don't want to do abortion because I'm not sure if I can get pregnant again. So I think that the proper education so the young folks that have the insurance and even before they get to the point of abortion will really be appropriated because people want to have the abortion, but they're also afraid that, hey, I may not get pregnant because other person did it and they didn't get pregnant. So, so I think that we should broaden our education topics and really get into the mind of young folks on what they want to do with their body. It's really nice to have this abortion, but it's also there's a downside to have abortion. So that's why I asked that question. But this is a really great topic for the community. And yes, I agree with Dolly. If we wanted to do it, I don't want to partner. I don't have specialties to do this, but also we should be able to know that I can send into Garcia, Virginia Garcia, or anybody that is doing this work if they have really good concern. Because I don't think our organization is this big to do this type of big work. So I would rather refer them to people that have the real knowledge, but as just a peer-to-peer conversation, I do have this conversation with people that trust me with their conversations. So, and that's why I was able to put that question out there. But I appreciate all the things that you do and all the partnership that you make to make sure that this message get out there.
Thank you, Mercy. It's so great to hear that perspective and that work that you're doing. Thank you.
You're welcome.
So it looks like we're out of time, and yeah, it sounds like we'll have the opportunity to send materials, including the slide deck, out to you all, including our contact information. So as Jill said, we would love to hear from you. Feel free to reach out. We can have further conversations.
Yes. Thank you so much, Emily and Jill. I know that as people are leaving, as we're hitting that last minute of the hour, you will probably get many gratitude shout outs in the chat. The information that you're providing, especially the way that you were able to handle the questions around folks being really concerned about their communities that want to care for each other through abortion access. Please continue to share what you know and continue to help educate community and provide opportunities for the folks here to continue to educate community. I put many links in the chat. All of those will be in the follow-up email, the presentation, Emily and Jill's contact. And I hope that this conversation will spur more conversations about the way that you all continue to show up in your communities and meet their needs. And so the theme that I'm pulling from today is the way that we trust community to know what they need. We trust individuals to know what they need, and being fully informed about all of the ways that they can meet that need is the goal. So thank you so much, Emily and Jill, for being here. Thank you, everyone, for coming. Please look for that follow-up email, and you know how to get a hold of us, I think. I'm pretty sure. A lot of you have Dolly's email, so if nothing else, Dolly can help direct the flow of questions and communication. Have a lovely October 3rd, and we will see you again in November.
Thanks, everyone. Take care. Bye, Jill. Bye, Emily.